Keeping an eye on your health now. We are near that time of year where it is hard to tell the difference between allergies and other sicknesses. The Asthma and Allergy Foundation of America says more than 50 million Americans have experienced various types of allergies every year. And joining us now is Dr. Mark Montano. He is the medical director of CareNow Urgent Care. Thanks so much for joining us today.
Of course, Michelle. Thank you.
Well, so many of us suffer from allergies. What are some of the symptoms that can help us distinguish between allergies and a cold or even COVID?
Yeah, and that's a great question. We hear that all the time from our patients. They'll come in, Dr. Montano, what do I have? I think it's allergy. And really, we have to look at the history and what they present with. So, allergies generally come with runny nose, sneezing, sometimes cough, itchy eyes. And so if you have those symptoms and you're an allergy sufferer, we may go down that allergy path. What if you have fevers, chills, body aches? Usually, allergies do not come with those symptoms. So if my patient has fevers, chills, body aches, I would generally say this is more likely a viral infection. We're seeing a lot of viral infections. The hard part is there are so many similarities that it can be hard to know. And the treatments may not be the same for allergy versus upper respiratory tract infection.
So it's good to get that checked out, right? What kind of allergy season are we expecting? We know we've had a lot of snow and moisture heading into spring.
I fear this is going to be a really bad allergy season. We've had great snow. Love the snow, love the moisture, but that means a really good spring, lots of growth, lots of plants and trees, and all of those things that produce the allergens will be out there in full force. I think we're going to probably have a allergy season that is ripe with trees and grasses and mold. And as we head into our warm, windy season, that will stir up all of those allergens, and people will feel the effects of that. They may feel pretty miserable as we move into April and May.
Yeah, my daughter's not looking forward to that. Her eyes get really puffy around certain times of year. What are some common allergies Coloradans deal with every year?
Well, we see the same things that all the other areas see. Now, when it's cold and snowy, those allergens tend to go away. But trees, grasses, and molds are the big ones. And the nice thing is there are websites that are put on by agencies, allergists, that really tell us what's out there. And you may not know what's high in the time of season that you tend to have your allergy, but you can always look that up. One of the things that I think we want to do, though, before we start talking about, what's going to be out there is as I start to have symptoms, what do I do? Do I wait till my symptoms are bad to start medicines? I don't want them to wear off before the worst of the allergy season comes. So what I usually tell people is at the first signs of allergy, start your medicines, whether it's a nasal steroid, an antihistamine, or even the antihistamine eye drops.
All right. All good advice, Dr. Montano. Thank you so much for talking with us today.
Of course.
Yes, great information there. And remember, you can watch all of our health interviews right now on CBSColorado.com.